Yes, please.
Mr. President, a few questions, if you don't mind, sir. If you've lost your job now, or you're worried that you're going to lose your job tomorrow, restaurant, something like that, what do you want people to do immediately? The second question, sir, we heard from the Vice President that he's going to be tested. Have you taken a test since last Saturday? I know you told us.
I just took one.
You just took one. How are you feeling?
I feel great.
Okay.
I
guess we'll.
I hope I look good.
You've taken more than one.
Those people are going to be.
You took the one, sir?
Sorry, hold on one
One
second.
test.
Yeah.
I
So,
took the one test.
The one.
One test.
okay, so for those people that have lost their job already, or they're worried that they're about to lose it tomorrow, what do you want them to do right now?
Well, what they do right now is keep receiving their paycheck, and hopefully their companies are going to be in a very strong position. We want to keep everything together because we think we're going to have a tremendous bounce back. Now, some people agree with that very strongly. Some of our top economists, they think we're going to have a once we solve the problem that we're working on, the medical problem. So we want them to keep their jobs, stay where you are, and we'll see what happens. Now, if they don't, we have unemployment, we have checks, we have a lot of things happening, a lot of very positive things. Nobody has ever done. Now, this is working with Democrats, this is Republicans and Democrats and myself working together. Nobody's ever done a package like this. It's a great package, but ideally we want them to be able to keep their jobs, keep the pay coming, and I think that's going to happen. Kelly, go ahead.
Mr. President, on your Defense Production Act power, one of the features of that is that the federal government would be able to control the output, whether it's masks or ventilators,
Right.
get it to the most areas of need, and control the pricing to keep it at a market level so it's not price
Right.
gouging. One of the things we're hearing from governors, they can't find supplies and prices have gone up. So you've talked about the act, sir, but you have not yet compelled any companies. Why not?
Because we have so many companies making so many products, every product that you mentioned, plus ventilators and everything else. We have car companies without having to use the act. If we don't have to use specifically, we have the act to use in case we need it. But we have so many things being made right now by so many, they've just stepped up. In fact, Mike Pence and I were discussing it before. We've never seen anything like it, where they are volunteering. We want to make masks, we want to, like Hanes, I brought that up as an example. General Motors, I bring that up as another.
They go on the open
Ford.
market, sir, right?
They're going to go on the open market. We want them on the open market from the standpoint of pricing, because otherwise, it's going to be, we could be very unfairly treated.
Direct them to the places in greatest need.
We are directing states, and sometimes we'll be competing against states, which I don't want, and we'll drop out of the bidding. We want the states to go first. And you know, what we're doing is we're helping states. That's what we want to do. Same thing with the testing. We're helping states. We're helping states get to where they want. And we've made tremendous progress in every aspect of
This
it.
happens for a
It's
governor
happening
who needs
fast now.
equipment today.
Well, it's happening fast right now, and the governors are out there trying to get, and if they are competing with us, we immediately drop out, please.
Mr. President, forgive me if I heard you wrong at the beginning, but you said something, we are going to be going over to the Hill. Are you going yourself to?
My people are, and I'll be staying here. I'll be in the Oval Office and various other places in the White House.
And on that matter, you're asking Congress to essentially pass a series of legislation that's going to amount to about $2 trillion, 10% of the GDP. What do you say to members in both parties who say this is too expensive, this is just too much to debate and get done in 48 hours or so? And also, have you spoken directly with Speaker Pelosi at all about any of this?
Okay, so I've spoken with, I'm not going to say who I speak with, but I've spoken with directly or indirectly everybody many, many times. We're doing very well. I think the Democrats and the Republicans are going to come up with a package that's going to be really something very special. It's going to help people. This is the first time there's ever been a case where you want people not to work. It's always, you know, you want to create incentive to work. We're creating not an incentive not to work, but the fact is we're asking people not to work because of they have to stay away from each other. If we're going to kill this horrible hidden enemy, we have to stay away. So there's never been a thing like this in the history of the world. And other nations are doing similar things, some effectively, some not effectively. They're doing similar things. We are creating a package that's going to keep companies together, keep workers paid so they can live and sustain. We'll see what the timing is. The biggest thing we can do is get rid of the problem. The problem is exactly what we know, the medical problem. We want to have this whole incredible situation that it can start right away. Not that all these companies break up, all the workers are out of jobs, you can't put them back together, and it would take years to put them back together. Because we had the greatest economy in the history of the world until we got hit by this problem. And we can be back very, very quickly, and it's our intention to be back very, very quickly. So we're doing a package, the likes of which nobody's ever done before. I'm obviously the one that has to approve the different things and the recommendations of the different things, and like buybacks as an example, and stock buybacks. I didn't like it the first time, and this time I'm saying, you're not doing it. I don't want money to be used for that. I want money to be used for workers and for opening businesses, keeping businesses, not buybacks. And, well, I am strongly recommending a buyback exclusion. You cannot buy back your stock. You can't take $1 billion of the money and just buy back your stock and increase the value. Please.
On the subject of masks, the Vice President announced HHS was ordering hundreds of millions of them. Was that order just placed today? How is that going to be distributed, and when can doctors and nurses expect to actually receive those masks?
Yeah, HHS is completing a $500 million order of N95 masks, and all of this is being coordinated through FEMA, and we are responding specifically to state requests where the needs arrive. As Dr. Fauci said, we want to make sure the people that are providing healthcare services to people who may have contracted coronavirus have the protection to keep themselves and their families healthy. But I want to emphasize the supply of so-called N95 masks has been vastly increased in the country because the president insisted that we extend liability protection to industrial masks. What all the experts told us early on was that industrial masks that are used on construction sites, the president's very familiar with from his past life, are perfectly appropriate to protect healthcare workers from respiratory illness. But they didn't have the liability protection because they weren't created for hospitals. We worked with leaders in both parties. We added that protection that runs through 2024, that now the industrial N95 masks can be purchased by hospitals, purchased by states, purchased by HHS, and distributed through our system. So we're making those available. The supply has been, as I said, vastly increased, and it was another step forward and a bipartisan accomplishment. And we're continuing to use all the kind of creative means of American industry to make sure that we're leaning into this effort and that we do whatever it takes to make sure that our healthcare providers have the protective
We
equipment.
are still
they need.
hearing from doctors and nurses about this shortage. When exactly can they expect to receive these masks, though?
Well, let me let Pete Gaynor speak to that, because FEMA will be, HHS is now fully integrated into FEMA, and so as the requests come in, but obviously, as I'm sure the administrator will say, they're being prioritized to those areas with the highest need. Pete?
So within the National Coordination Center, we have a supply chain task force. And in basic sense, we're trying to identify the universe of what's out there. So whether we hold it at the federal level, we hold it in the private sector, and then match that up with demand and asking people to be creative. We're asking, again, this is a shared responsibility. We're asking locals and states to do your share locally, try to take a little bit burden off of us, and then we'll prioritize those scarce resources, because every single governor across the country is looking for the exact same thing. So there's a balance, but we're examining the entire supply chain to make sure that
When
we
will
make
the
a,
masks start coming in?
they're out there now. So again, we want to match. We want to get out of the middle, I think.
Yeah, that's what I like to know.
So we're trying to match suppliers with demand. So that's what we're doing right now. It's happening today.
They can expect them today, or they're matching supply and demand?
There's a range of requests across the country, and we're trying to match those, again, supply and demand every day.
Are you
through the task
satisfied with
force.
that?
And we have a lot that have already come in. A lot have already come in. I have to tell you, the throwing away of the mask, being in private business, the throwing away of the mask right away, they're thrown away, and when you hear 55 million masks were ordered, I'm saying 55 million, how could it possibly be such a number? And they say, oh, that's just a small fraction of what we need. And I said, why aren't we sanitizing masks? You know, you look at the masks, I've looked at all the different masks. Some don't lend themselves to doing that, I think, but many do. And I said, why aren't we have very good liquids for doing this, sanitizing the masks. And that's something they're starting to do more and more. They're sanitizing the masks, and I don't know if anybody would like to speak to that.
We issued guidance on CDC.
You might want to discuss.
Yeah, there are CDC guidances about how you can minimize the use of masks by different things that you could do with testing, and when you have masks, how you might reuse them, which ones you can reuse them.
Do you think there's a solution to this other than buying more masks? Do healthcare providers need to change how they're using them?
Yeah, well, there are a couple of things. One, for example, we are moving towards getting testing where you don't have to have PPE. I mean, I'm not gonna tell you the day it's gonna be there, but it's gonna be a swab that you could stick in the nose of the person who is either infected or not, but that person doesn't need PPE, the person who's administering the test. So if you could do a self-administered test, stick it in a vial, hand it over. You don't need a mask, you don't need PPE. That's one of the things we're trying to do.
I would have liked that much better. Personally, yeah, go ahead.
May I? And one other, this is another story about great American industry. The president and I literally heard directly from Apple that they're donating 2 million industrial masks to this effort around the country, and,
Yes.
and working with our administration to distribute those. And it might be a good opportunity for us to renew our call as the president and I delivered this message to businesses yesterday, manufacturers and small businesses. It's a great time to go to your storeroom, and if you have N95 masks, if you've got 100 of them, if you've got 10,000 of them, is to load them up, drive them over to your local hospital. That story is literally happening all over the country. And now with more Americans stepping away from elective surgery, including elective dental care, we're urging dentists around America to look at their supplies of N95 masks and make those available to our hospitals. But the great news is, as the president said, the American people are all doing this now. So allow me to say on behalf of the president, thank you for what you all are doing today, but we want to encourage people in business, encourage people in dentistry in particular, look at those supplies of N95 masks, pack up as many as you can spare, drop them off at your local hospital, be a great service to the country.
Mr. President, I just want to read you some of what some of the doctors on the front lines of this crisis are saying. Dr.
You mean the
Faze-
ones that are saying good things or bad things?
These are doctors who are talking about the shortage of medical supplies that they are facing. Dr. Faiza Bucks in Kentucky says there's absolutely no way to protect myself. A surgeon in Fresno, California says we are at war with no ammo. Dr. Mel in Illinois says if this is a wartime situation, then now is the time to act. I know you're talking now about increasing production at so many of these facilities to get the masks out, but given that this is one of the wealthiest, most powerful countries in the world, should this even be happening? Shouldn't this have been resolved weeks ago?
Well, I'll tell you the way I look at it. So many administrations preceded me. For the most part, they did very little in terms of what you're talking about. This is unprecedented. You could speak to Tony, you could speak to anybody. This is unprecedented or just about unprecedented. As time goes by, we're seeing it's really at a level that nobody would have believed, nobody would have thought possible that this could happen. And we are making much of this stuff now, and much of it's being delivered now. We've also gotten tremendous reviews from a lot of people that can't believe how fast it's coming. I mean, when I hear they have an order of 55 million masks, and that's just one order, that's one order out of many, and that there are many millions of masks beyond that are, and I keep saying, how is it possible to use so much? But that's the way it is. And part of that is because they'll use a mask for a short period of time and they throw it. The fact is that we are doing a tremendous amount. We started with very few masks. We had some, but nothing for an event like this. And now we're making tens of millions of masks and other things. And I think it's unprecedented what we've done and what we're doing. And many doctors, and I've read many, many doctors, they can't believe the great job that we've done. Yes,
It has been many,
Kelly,
Mr.
did you have
President,
one?
it's been nearly 3 months since your administration learned about this virus.
Well, if you remember, I was
So
the
why
one
not
that,
act sooner?
I was the one that closed the country down. I was the one that closed the, you don't write that or you don't say it too much, certainly on CNN. But I just read an article yesterday, that by closing the country down so early, very early, we saved tens of thousands and much more than that lives. So, you know, you might want to report that too. Go ahead, Chris.
I'd just like to address that for a moment. Again, I'm an ICU physician, ran health systems, and I, first of all, want to thank everyone who's on the front line in the emergency room, in the ICUs, in the hospitals. I speak to my colleagues daily. We need to preserve our PPE to the degree that we can. CDC guidelines has had that. The president has talked about it. But I also want to say we are making product, as the president said, but we are also responding through the FEMA system to distribute the strategic national stockpile resources according to requests that come in. Stockpile has been distributed to many states, first orders, second orders, and on a daily basis adjudicating that. If there are shortages in your hospital system, I can't tell you of Dr. X, Y, Z, that needs to be clearly iterated to the local emergency management.
Are you seeing those hospitals talking about the
We
shortages?
were on the
asking federal
phone 2
government?
nights ago or 3 nights ago with over 2,000 hospitals or hospital systems sharing best practices from Seattle, where they've been very innovative, pioneering some of these areas. When there is a shortage, they need to go through their emergency management. It goes directly up to the FEMA system, which really rocks. It really works very, very well. And then there's the distribution of the stockpile. Now, the stockpile isn't infinite. That's why it's being replaced by all the orders. But masks, supplies go out on a daily basis as they are needed and requested through the FEMA system. And I don't know, Administrator Gaynor, whether you want to add to that.
Tony, would you like to say something about that?
Just to reiterate what Brett said, we don't take lightly what you just read. You know, I mean, I get the calls every night, the way you get emails. It's a serious issue. We don't want that to happen, but it is happening. You're not making things up. I know that because I'm experiencing myself. But what you just heard about the different avenues, some of which aren't even recognized, about how you can get help through the FEMA process, in addition to the large amounts of additional PPE that's coming into the system. We hope that very, very, very soon, we're not going to get those kinds of real-life difficulties. Yeah.
Seems like there's a question about the timeline here, and even FEMA can't quite answer what the timeline is. Days, weeks. You know.
Yeah, sooner than weeks. It's going to be days, I would hope. You know, we're going to try to make it days to the best possible way we can.
And again, what we're doing is we're trying to help the states get things faster. And that's what we're doing. We're implementing. And the magnitude of this, it's a tragedy. It's an absolute tragedy. But the magnitude is something that no matter who you were, no matter where you come from, nobody ever thought a thing like this could happen. You read about 1917 and you read about certain things, but you think in a modern age a thing like that could never happen. Well, it comes back. It is genius. It comes back, and it's too bad. But I think the people working on this have been incredible. The job they've done has really been incredible. But there's tremendous amounts of not only masks, of ventilators and respirators and everything you can think of. It's all being, much of it, and almost, I could say all of it is being manufactured right now. Steve, please.
Yesterday, there were questions about the use of this malaria drug. Have those questions now been resolved?
Well, I don't know that resolved. I could say that it's going to be distributed. I know New York is getting, I think, 10,000 units, and numerous other people. It's really, it could be the malaria drug plus the Z-Pack. But, and we're going to find out. We're going to find out. I feel, look, I feel, as the expression goes, what do we have to lose? Because, you know, I feel very good about it. Tony would feel, you know, like he'd like samples done in a certain way, and I understand that too. Many doctors agree with that. We don't have much time. You know, we have a lot of very sick people right now in hospitals all over the place. And speaking with the governor, New York, Cuomo, I said, how's it look? He's got a lot of sick people. So we're going to be delivering a lot of samples to New York and other places, and we're going to find out very shortly whether or not it's going to work. I feel very confident. I mean, I've seen things that surprise me, frankly. There are, as Tony said, there are other things we're looking at too. Vaccine, of course, is incredible, but this is more immediate. Right now, this to me would be the greatest thing that could happen. This would be a gift from heaven. This would be a gift from God if it works. So we're going to pray to God that it does work. It'll be a fantastic thing.
Mr. President,
Yeah, please, Rebecca.
Mr. President, on the economic front, there are reports that coronavirus is really hurting your businesses, especially your hotels.
My businesses?
Yeah,
Sure.
so is that true, and can you speak
Well,
to
I
financials?
wouldn't say you're thriving when you decide to close down your hotels and your businesses. No, I would say, but, I'm very underlevered and everything, so that's good. But is it hurting yeah, it's hurting me, and it's hurting Hilton, and it's hurting all of the great hotel chains all over the world. It's hurting everybody. I mean, there are very few businesses that are doing well. Now, there are some that are, like, as an example, the Walmarts of the world, because everybody's lined up to get things and stock up their house and this and that. But sure, it hurts my business, but
And did you or anyone in your administration talk to anyone at the Trump Organization about the potential effects of the coronavirus?
no, I didn't speak to anybody. I speak to my sons, but I talk about the coronavirus, but not as it pertains to my business. They basically follow the rules. When they say close them down in New York, we close them down, or wherever they may be. I actually have them all over the world.
Will you no longer
And
go
when
to
they say close them down, we close them down. What, Kelly?
Will you no longer go to Mar-a-Lago or Bedford?
Well, I have nothing planned at Mar-a-Lago, but right now, I think Mar-a-Lago, I guess, I haven't even asked, but I imagine that's closed down just like a lot of other businesses in Florida, right? Go ahead.
Do you expect your family company to seek government assistance if it's eligible?
I don't know. I mean, I just don't know what the government assistance would be for what I have. I have hotels. Everybody knew I had hotels when I got elected. They knew I was a successful person when I got elected, so it's one of those things. I guess I get paid $450,000 a year. I give it up. I put it back into the nation. I have to, by the way, you have to designate where you want it, so I oftentimes give it to opioid, research and things.
Specifically, not you.
But as far as the hotels and everything, I mean, I have to do what everyone else is doing. I would probably decide to close things up. I think it's a good thing. You don't want people getting together. And hotels and clubs and everything, you get together. We want to beat this deal. So I have many of them, hotels, clubs, things like that, where people get together. I would think it would be a good practice to close them up. Yeah, go ahead, please.
Mr. President, as you know, we've been talking a lot about masks. We've also talked about how not everyone needs to take a test. What about a temperature test? As we know, we all came into this room and got
Yeah.
tested before we entered.
Well, I do
the
it. I
grounds.
do it. I have temperature tests, and
But should
I didn't ask everybody here, but I wouldn't be surprised if they had temperature tests.
Should those thermometers?
Otherwise, I'm gonna run off the
sensors
stage.
be distributed? Should they be on a mass distribution basis too?
Oh, I think they are pretty much. The easiest thing is the temperature. I think they are. I don't know. Are you learning a lot from the temperature test, Tony? Could you maybe discuss that for a second?
Yeah, I mean, they have a place, they're not infallible. I mean, there's so many ways to get around that. I mean, right now, every time, certainly here, every time I go into a different room, I get my temperature taken. But we see that on the outside, that some people are
I
doing
took his
that.
temperature
He did.
twice, actually.
It was very low. There is a role for it under certain circumstances. What I don't see is a massive distribution of thermometers that are going to actually have a major impact on what I showed, what we need to do.
And I've seen things when Tony mentions thermometers. They aim something at your forehead, they stay this far away, boom, and they tell you what your temperature is. I said, I've never seen that before. I've learned a lot. It's incredible. Go ahead, the back corner.
Jen Pellegrino with OEM, thank you. This morning, the Washington Post ran a story suggesting that you delayed taking action on the virus in January and February. Dr. Fauci has indicated that your action in the Chinese travel ban helped America immensely. What do you say to the Washington Post?
Well, I love whoever you're with. That's because I think that's such a nice question. No, I think the Washington Post covers us very inaccurately, covers me very inaccurately. I saw this story. I think it's a disgrace, but it's the Washington Post, and I guess we have to live with it. It's a very inaccurate, It's a very inaccurate story. From many people, I get a lot of credit for having closed our country very early to a very heavily infected country. China, unfortunately, China. I wish China would have told us more about what was going on in China long prior to us reading about it, even though the news isn't exactly disseminated. As you know, China kicked the Washington Post out of China, and they kicked the New York Times out of China, and I guess the Wall Street Journal. That's okay. I mean, that's what they do, and I think it's a terrible thing they did. But I also think it's terrible when people write inaccurately about you, and they write inaccurately about me every single day, every single hour. And by the way, your group really, I really think, and I just say fair, not good or bad. I think you write very fairly and do very fair reports about the great job that all of us are doing, that this group behind me is doing. It's so insulting when they write phony stories that they know are fake news, because they're not insulting me, they're insulting everybody, these incredible people that have worked so hard, so long, that are thinking about nothing other than this invisible enemy. They have done such an incredible job, and they will continue, and we're going to win, and there'll be a lot of celebration when we win. And we're going to win with as few lives lost as possible. That's the game. Win with as few lives lost as possible. It's a tough enemy. It's a tough killer. Far bigger, far more vicious than ever before. But I appreciate you saying it, because the fact that we closed so early to China, and most people, hey, look, I was called xenophobic by Sleepy Joe Biden. I was called a racist by Democrats, a racist. I was a racist because I decided that I didn't want to have people that could hurt our country come in. And I was pretty much in a very small group of people, I will tell you. It was a tiny little group. Most people, even that worked in the White House, disagreed with me very strongly. Saving of those many weeks was a tremendous thing. And when they keep talking about acting early, that was the ultimate act. That was the biggest act, because we didn't. And then I also closed Europe early, very early. And I took a lot of heat for that too, but that was a good thing. Now they're doing similar things that we're doing. So I didn't act late. I acted early. I acted far before anybody thought I should be. I took tremendous criticism from the various papers, from many of the papers. So I very much appreciate the question. It might have been more of a statement than a question, but whatever it may have been, I appreciate it very much.
Mr. President, about this, so a number of the states have kind of done these different measures. We've seen California order one
Yes.
thing, New York, just be similar. Do you want all of the states to do one uniform?
No, they can do what they want to do. If California can get a mask sooner than we can get it for them, through all of the things we're able to do, I mean, we're going to end up with a big oversupply at some point. At some point, this is going away, and we're going to end up with a big oversupply. And you know what? In this case, that's going to be okay. But if Gavin can go out and order gowns faster, or masks, good masks faster, or other things faster, that's good. We do have a lot of, the coordination with the ships that we're sending in, as you know, the medical ships that we're sending in, and even cruise liners. We're going to be sending in probably cruise liners into some areas, in particular California and in particular New York. But if somebody can do something faster, if they can order that mask faster than us, I want them to be able to do it.
Sorry about the rules, sir. So people can't leave their homes. That certain businesses. That are
We
exempt.
coordinate very much with them, yes.
You don't want all those to be the same.
Well, it doesn't
nationwide.
have to be at this moment, because we have places in the country where, states where they have 2 people or 3 people, and those people are in quarantine. And you can't put on them what you're putting in New York, where you do have a tremendous problem. I mean, we have large portions of the country, middle America, where, they have a few people. So it may be a time, I hope that never happens, where we need to take very drastic action. But right now, that's not in the same ballpark. Yeah, go ahead, please.
We're at day 6 into your 15 days of recommendations.
Yes.
A lot of people are following them. Some people are not.
Yeah.
Do you think the American people are doing enough right now to slow the
I
spread
think
of the
they
virus?
are, and some people are not, but I think they are. I think it's going to have a very profound effect. I mean, we'll know a little bit more on day 14 and 15, and we'll
What's the
see.
plan once we get to
Well,
the
we're
end?
going to see. We have to see what the result is. We want to flatten that out, and we're going to see what the result is. And I just want to say, I'm going to negotiate a very large transaction, and I've been negotiating it for 2 days. So I'm going to take 1 or 2 more questions, and then I'm going to leave it to Vice President Pence on the Hill, with the Hill, the various elements of the package. Steve, go ahead.
There's a number of groups are calling for the postponement or cancellation of the Olympics. Have you given any third?
No, I haven't. Look, we understand the difficulty of that, and he's a very good friend of mine. You take a look at Shinzo Abe. He's a great gentleman. He loves his country. We have an incredible relation. We just finished a trade deal with him, $40 billion trade deal with Japan. And Prime Minister Abe has a big decision to make. They have built one of the most beautiful venues I've ever seen They're all ready to go. It's not late, it's not over budget, it's not, it was just done flawlessly, and it's beautiful. And they're sitting back and saying, you know, I told him, I said, that's your decision, and it is his decision, and I know he's gonna make it soon. I don't know what it's gonna be, and I didn't think I should be influencing it at all. I mean, the job that Japan has done on that venue is incredible. So, I mean, there are options, obviously, including delay and maybe delay for next year, but that's totally up to them. We'll see what they do.
Since this story keeps popping up, when did you first learn that this was going to be a problem?
Well, you know, when I learned, I started doing the closing, so, you know, probably around that time. We didn't learn much. I think you're going to ask a little bit about China responsibility. I do think that, again, I have great respect for China. I like China. I think the people of China are incredible. I have a tremendous relationship with President Xi. I wish they could have told us earlier about what was going on inside. We didn't know about it until it started coming out publicly. But I wish they could have told us earlier about, because we could have come up with a solution. Tony Fauci and all of the people, the talent that we have, would have loved to have had 3 or 4 months of additional time if you knew that this was going to be happening. They didn't have that time. They read about it in newspapers like everybody else. China was very secretive, okay? Very, very secretive. And that's unfortunate. With that, I have great respect for that country. I have great respect for the leader of that country and like him. He's a friend of mine. But I wish they were able to, I wish they would have told us earlier, Steve, that they were having a problem, because they were having a big problem and they knew it. And I wish they could have given us an advance warning, because we could have had a lot of things. As an example, some of the things that we're talking about, where we order them as quickly as we can. If we had a 2 or 3 month difference in time, it would have been much better. Yeah, please.
Can I follow up on that?
Yeah.
Because as you were saying, China was extremely secretive about this. Several of your advisors have been warning, have been critical of China. Secretary Pompeo was talking about it yesterday, and he had been saying so for quite some time. So why then, on January 24th, did you tweet that China has been working very hard to contain the coronavirus, that the United States greatly appreciates their efforts and transparency?
Because
It will
it's
all
true.
work out well.
Because
Why were
it's
you
true.
saying that, though?
China has worked very hard. China has lost thousands and thousands of people.
Right?
No, they weren't transparent. They were transparent at that time. But when we saw what happened, they could have been transparent much earlier than they were.
A month after China
But
discovered
China,
the
just so
virus.
you understand, China is not a beneficiary here. China has lost thousands and thousands of people. China has gone through hell over this. They've gone through hell, and I've had conversations with President Xi. I just wish they could have told us earlier. They knew they had a problem earlier. I wish they could have said that.
Are you able to share, thank you for the numbers on the testing, by the way. Are you able
Thank
to
you.
share any other hard numbers on number of available tests, on number of ventilators in the federal stockpile?
Well, I'm going to leave that up to Dr. Fauci and everybody else, and I think the answer is we want to share them. I would imagine we want to share the numbers as, Admiral, do you want to discuss that?
500 billion masks that you cited, they're due for delivery in 18 months.
Not billion, no, not billion.
500 million masks,
Yeah.
excuse me, thank you.
I said, wait a
The
minute.
500 million masks, they're due for delivery according to HHS within 18 months. The last number on ventilators we had was 12 to 13,000. Can you give us an updated number?
Well, there's
on that?
never been numbers like this. You know, a ventilator is a machine. It's a very complex machine. And to think that we have to order hundreds of thousands, nobody's ever heard of a thing like this. You know, when we had in the stockpile, we had thousands in a stockpile, thousands ready to go. That's a lot. All of a sudden, you need hundreds of thousands. And you're not talking about, you know, the mask is whether it's plastic or whether it's material, that's one thing. But you're talking about a very sophisticated, heavily computerized machine, and delicate. And you need hundreds of thousands of them. Nobody's ever heard of a thing like that. With that being said, General Motors, Ford, so many companies, I had 3 calls yesterday directly. Without having to institute, like, you will do this, these companies are making them right now. But to think of these numbers, it's pretty mind-boggling.
Do you have numbers to share, though, right now? Do you have numbers to share with us right now?
Well,
on stockpile?
Mike, go ahead, please.
Yeah, you bet. Well, we've spoken a lot about masks this morning, but the president's also given the task force a priority of assessing the availability and expanding the availability of ventilators. And on Monday, we will detail some very encouraging news for Americans. You speak about the number of 13,000. It is a little more than that we have in the national stockpile. But it's important to remember that that doesn't include the more than 100,000 ventilators that are in healthcare facilities and hospitals around America today. It doesn't include what will be produced, as the president said. We're seeing companies step forward. These manufacturers tell us that a ventilator actually isn't a very complicated piece of equipment, and many of them are literally surging forward to create more ventilators. But one of the more exciting developments in the last week, which we'll detail more on Monday, is that in the president's engagement with our healthcare community, we learned that ventilators that are currently used by anesthesiologists, that are used in outpatient clinics and in other procedures, can be converted to be used as ventilators for people struggling with the effects of the coronavirus. We've confirmed that a particular screen in that device can be changed readily. We're working with the FDA to approve that. But again, it's a great testament of the American people and our healthcare professionals that are stepping forward and bringing ideas forward that literally, as we'll document Monday, will increase the supply of ventilators by tens of thousands. But look, the president's made it clear. We want to make sure that all the incredible, courageous men and women who are serving in healthcare around America have the support they need, that our patients that are struggling with recovering from coronavirus have the equipment they need. And we'll have a lot of detail on Monday as we continue to assess
Days ago that
what's
we would have
available.
1.4 million tests on board by the end of this week, by today. Do we have that? Can you give us the number that we have?
Let me let Admiral Gloss speak to that.
Thank you.
So I'm going to answer your question and then try to persuade you to stop asking about a specific number, okay? So from March 2nd to March 14th, we have put over 10 million laboratory tests into the U.S. commercial market, and we expect that by March 28th to be well over 27 million into the market. So that answers your question, and let me tell you why it's not the right question. Not every lab can run every test. Not every test is completely self-contained. So the more important question is not how many tests are in the market. We got them in the market, but is to make sure that every segment of the market has the kind of test that they can use.
Admiral, we're using your numbers, trying to find out for the public if the things you've promised are happening.
Yes, they are happening. They are we promised 1 or 4 million. There's 10 million tests in the market
And
now.
are the masks that are in the strategic reserve being deployed, Mr. Vice President?
Yes, the masks in the strategic national stockpile.
So it's not 13,000 anymore, it would be a lower number, would that be fair to say?
Masks are
No, the ventilators. I'm sorry, the respirators. Thank you. We're trying to understand if the things we have been told sitting through these briefings for many days are happening and getting into the hands of the healthcare providers.
You understand it. You understand it.
We're trying to
You're an
understand,
intelligent
sir.
woman, Kelly. You understand exactly what he's saying. And what he's saying is rather incredible, because we inherited an obsolete, broken system. And when you hear the number of tests that we'll be providing and are now, it's incredible. And I've heard a lot of governors say the same thing. We took over an obsolete, broken testing system that wouldn't have worked for even a small problem, let alone one of the biggest pandemics in history. And what these gentlemen have done is incredible. I am going now to negotiate a great deal for our workers and our citizens. I'll be back tomorrow. We're probably doing this tomorrow. And if I might, I'd like to ask Vice President Pence to take over. And thank you all very much. Thank you.
Thank you, Mr. President.
Mr. Vice President.
Thank you all. Sorry, how about back here?